Hi everyone, my name is Dr. Tabaie and I'm a pediatric orthopedic surgeon here at Children's National Hospital in Washington, D.C. I focus on limb deformity, trauma, and the treatment of children with cerebral palsy. It's a pleasure to be with you guys today, and we're going to dive into a little bit about orthopedic conditions here at Children's National. So the first question we have is, what are the most common orthopedic conditions that I treat? So I think myself and a lot of my partners, our focus is always going to be trauma and just common injuries that happen to kids on a daily basis. So we see the daily fractures you see from common things kids are involved in, such as sports or just playing in the playground. But additionally, we all have our subspecialties. And for myself, I take care of children with cerebral palsy and the associated orthopedic and bony issues that they have due to their underlying cerebral palsy. So this could be due to their muscle spasticity and their muscle tightness, and it can also be bony deformities, which cause issues with them walking. So often we treat their orthopedic conditions to help them walk more efficiently and to be more active with their peers. Lastly, I take care of a lot of children with limb deformities, either from trauma or ones that are born with congenital limb deformities. Next question is orthopedic surgery more common in a certain age group over others? So this is a great question. Often in a very young child and infants, orthopedic surgery is not necessarily needed because the body has a great ability to heal itself and to what we call remodel and to develop normally over time, even after a break or a fracture, whatnot. Often when we get involved is when the children are older, I would say in their elementary school years, where they start breaking bones and we need to get involved with casting. And as they get older, then the potential of their bones to heal on their own changes. And that's when we have to consider surgical options, such as, fixing a fracture or a broken bone with hardware, which include metal plates and screws or even rods within the bones. So as you get older, the actual surgical part does increase. What are the most common orthopedic conditions seen in babies? I would say there are two very common ones that we see as orthopedic surgeons. The first one is club foot. I'm sure a lot of people have heard of a friend, child, or a family member having club foot. And that's one of the most common foot congenital conditions. That's when a baby's is developed in a rigid, curved fashion and is not amenable to the normal progression. So it requires a set of casts to get the foot back in a more normal position. And the second most common condition we see in babies is what's called hip dysplasia, when babies are born with the femoral head or the ball of the femur outside of the socket itself. In regards to tips for parents on what to keep an eye on. So, this is difficult for parents, especially first-time parents, because we always want to make sure our children are doing well, and we're very keen on if something's not going right. So I think that's really the main point I want to stress, is that you have to really watch your kids and see if something is changing from their routine. If they were walking at an early age and then they stop walking, or if they're complaining of increased pain that's affecting their activity levels. So anything that you feel is changing their routine, that's something that should raise a red flag and kind of direct you on getting an opinion on why something's happening. So thank you all again for your time. It was a pleasure to be with you. Please feel free to reach out to our orthopedic department if you have any questions about your own child, and we look forward to seeing you all soon.